Okay, guys, so in this video, we're going to be talking about antibiotics. So first, I'm going to cover a couple kind of what I think are like important kind of key principles and a framework to kind of mentally think about these, at least for the inpatient setting. And then after, I'll go over a few different resources that I think everyone should kind of be aware of for choosing antibiotics. Um, Let's see. So this is just kind of a little cheat sheet that I've been using that I made. I posted this to the our shared Google Drive if anyone wants to use it. But this was kind of a framework. One of the attendings kind of told me this is a good way to kind of a basic way to think about antibiotics. And so you can break them down into three categories. And then I think for the most part, I have kind of most of these memorized. But also I can just pull it up on my phone quickly. So I'll kind of run through this. So the kind of the four common ones to know are antibiotics that cover MRSA or MRSA, then Pseudomonas, and then anaerobes, and then atypicals. And then also you kind of want to know when to use these. Um, but that's kind of a different topic. But I think knowing kind of a few antibiotics in each of these categories can go a long ways. And then this is also kind of a common thing that comes up. So if we're discharging somebody or just switching in hospital from IV to PO, um, antibiotics as far as covering MRSA, then these are kind of the ones that we would go to. And so I kind of have some notes here, but these are definitely ones you need to kind of have memorized. And then lastly, I just had this on kind of my cheat sheet. So before starting, azithromycin and then the fluoroquinolones. I think there's a couple also that do this, but they can cause QT prolongation. So that's something to be aware of. Um, and then if it's someone who you might think might be higher risk, like someone who's older or who has heart conditions, a lot of times we'll get a baseline EKG. And specifically on the EKG, what you're looking for is the QTC. So it'll give you the QT and I believe the QT and the QTC. That stands for the corrected QT interval. And so if it's prolonged, then these would kind of be contraindicated depending on how prolonged it is. Um, so that's kind of some basics, and there's a lot of other resources as far as antibiotics and like different kind of ways to approach thinking about them. I think it's useful to have kind of like an initial or like kind of a mental framework of these, and then also you do have to kind of memorize some. Um, but kind of as you use them and over time, you'll memorize them for the most part. Let's see. So now I'm going to go over some antibiograms and kind of resources for these. So first off, you'll probably see like say you're admitting someone for COPD, you'll probably when you're starting off, if you're an intern or med student, you'll be looking like on say UpToDate or the hospital's handbook, and kind of you'll be looking at like the entire treatment, like okay, the patient needs to be on steroids, antibiotics, and kind of within that resource, it's going to give you some options for antibiotics. So that's kind of the first resource that you would probably be using or have. And then I'm going to share some other ones. So this one you definitely need to be aware of, the hospital antibiogram. So I'm on the CMC internet right now, and then you can just open a new tab and click here and then click on antibiograms. And then for some reason I feel like they don't have the most up-to-date one, but just click whichever one is most recent. And then it's going to show 2 pages here. And I use this a lot. Sorry. And so here it's got the diagnosis. It doesn't have everything. And then they give you the total days of like recommended how long the patient should be on the antibiotic, and then inpatient treatment options, and then outpatient. So for example, a COPD exacerbation here, they recommend a 5-day course. And then if it's inpatient, either these antibiotics. If it's outpatient, then you can do these ones. And then the second page here, this shows the susceptibility. So it's how susceptible each bacteria is to the different antibiotic. And so these, pretty much any hospital you're in is going to have like a local antibiogram. That's kind of what this one specifically is. And so I've talked to some different people, like one of the hospitalist pharmacists, and then I've done some reading on this. From what I found, you ideally want this number, the susceptibility, to be greater than 90. Sometimes like That's ideal. Sometimes you can go like greater than 80, but below that, then you're not going to have very good coverage. Like, so one example of that is levofloxacin or Levaquin here. It has a lot of resistance that it's developed to Pseudomonas. And so if you look on a lot of some antibiograms, it'll say like, hey, this is like one that you can use to cover Pseudomonas, but really it has poor coverage. And so here it shows like 73%, which that kind of makes sense. Like it's definitely below 90, it's below 80%. So this is another resource to use. Another one in this one, let's see. Sorry. So this is another one I like. This one I found online, but it's one of the best ones I found. And this one definitely isn't local, so be aware of that. But I feel like it's more educational, and I think it's useful to have several. Let me just make this bigger. I think it's useful to have kind of several of these to reference. Let's see. So let's go over to, let's go over to the Pseudomonas here. So this one kind of lays it out more clearly. So here's Pseudomonas, and then it tells you generally these antibiotics have good coverage, kind of that fall into this column right here. So that's one to use. Let's see. And then lastly, I'm going to show you guys. And I'll go into this in more depth in a different video, but there's order sets that we use in the hospital for admitting patients. And then these will give you good recommendations as well. So if you type in HOS and click enter, you'll see all these different order sets. And so the ones that have like antibiotics related to them are going to give you recommendations. So there's the sepsis one, that one's good. And then I'm going to go with the pneumonia one to show as an example. So this loads. Here we go. So this is an order set, and it's specific to pneumonia. So if we scroll down, it's got antibiotics here, and then it has different kind of different like settings kind of. So moderate pneumonia, which antibiotics you'd use if there's a high MRSA risk. So let's click on this one if they don't have a risk of MRSA or Pseudomonas. And then so it gives these recommendations. These are pretty standard too, like ceftriaxone, azithromycin. If they're allergic to those, then you can try Levaquin. All right, so this is also a good resource. So I think kind of to just summarize things, I think it's good to have a lot of resources at hand, and then to have, or at least a few, and then to have kind of a good mental framework of the antibiotics. All right.